When it comes to measuring the health and development of a country, one key indicator is its maternal mortality rate.
The CDC defines a maternal death as the death of a woman while pregnant or within 42 days of the end of her pregnancy.
The CDC released data that shows in 2023 the maternal mortality rate decreased to 18.6 deaths per 100,000 live births, compared with a rate of 22.3 in 2022.
While this does mark an improvement, a particular group of Americans saw an increase in maternal mortality.
Pregnant Black women who are dying at a rate more than 3 times that of white women.
The United States has the highest maternal mortality rate of any industrialized country in the world.
Why is that?
Many of the maternal deaths, especially in Black women, are because of the biases that still exist in our system. Frankly, are less likely to be listened to when they present with complaints.
Dr. Graves is one of many who are working to make it safer for women in the U.S. to give birth.
One woman who she helped to save is now doing the same through changing the law in her state.
Reporter Lauren Lowry shows us how.
From her state office downtown, Memphis Senator London Lamar gets to work. Taking office in 2019 at age 28, she's the youngest woman and the youngest African American to ever serve in the state legislature.
My ancestors and the people came before me, the Black women, the Black men, built this state. I am Tennessee's history, whether it's acknowledged or not.
In 2019, the senator made more history.
And come up with real solutions.
Shown here debating while pregnant, but on one particular day.
October 17, 2019.
Everything changed. At 8 months pregnant, London Lamar nearly lost her life. Her little boy did not make it.
Is it safe to give birth in Tennessee?
Absolutely not. Absolutely not. This is a dangerous state to have a child. Black women are dying more than anybody else. I noticed that for myself, my freshman year in the legislature, losing my son at 8 months pregnant because of preeclampsia.
Preeclampsia is the #1 killer of pregnant women and the #1 cause of stillbirth in babies. Thanks to research that's emerged in the last 15 years, preeclampsia is now recognized as a heart disease.
Most women who die in pregnancy don't die during labor and delivery. They actually die after labor and delivery, often presenting back to the emergency room, often ignored when they present back to the emergency room, sometimes even sent home after they present to the emergency room.
During our interview,
Hey, it's Dr. Graves.
Dr. Graves got an emergency call for a new mom.
She probably has postpartum preeclampsia.
Dr. Graves is the reason Nashville was the first city in the country to get access to a preeclampsia test, detecting the disease with nearly 100% accuracy. We interviewed the Nashville woman who was the first in the country to receive the test. She and her baby saved because of the test and care from Dr. Graves. Right now, Graves is running 3 different research projects on this issue, including one for the NIH and for the American Heart Association.
So when this is personal for me, so it is so important for those of us who are passionate about, this problem to also research the problem to figure out how we can absolutely do better.
At the Capitol, Senator Lamar is addressing it through new laws. And in 2023, she made history again, becoming the first sitting senator to give birth while serving and introducing baby Nyland to the legislature.
I knew that God sent that baby here for me to try again. Everything I could do to make sure that this child made it to the end, and I made it too, and we did. My son gave me purpose. When I say I wake up every day and I look at his face and it reminds me of what I'm fighting for.
Say hello. He's not ready to speak yet.
That's really what pro-life is all about, is to ensure that women and babies can make it through the totality of the birthing process and have a good life.
In response to the CDC report on Black maternal deaths, the Policy Center for Maternal Mental Health released policy recommendations to improve patient care.
Those recommendations include increasing the number of Black obstetric professionals by creating programs to attract diversity and testing for proficiency in recognizing bias.